Good afternoon, and welcome to Kelsey-Seybold's multi-part series highlighting accountable care in action. My name is Kenneth Janis, and I'm Vice President of Healthcare Finance for Kelsey-Seybold. We know there is increasing interest about the accountable care model. What does it mean, and how it can save costs without reducing the quality of care a patient receives? And while there are numerous statistics and data points I could share with you and prove accountable care works, sometimes the best way to tell the accountable care story is through real patient experiences at Kelsey-Seybold. But first, let me share one data point that many of you probably know in relation to healthcare spend. We know that 5% of plan members make up 50% of today's healthcare cost. Even more startling is that about 1% of plan members drive over a quarter of healthcare cost. Those costs are driven by high-cost claimants with complex comorbid conditions account for the majority of the healthcare cost. Those that work in HR departments or consult with human resources know that high-cost claimants are not being effectively managed through traditional health plans or wellness programs. The only proven model to delivering effectively and managing high-cost claimants is coordinated, accountable care. Kelsey is focused on improved health for patients through disease management and intervention and avoidance of catastrophic claims. In fact, our health benefits plan, Kelsey Care, has ranked for 7 years as the market's most cost-effective health plan according to Aon Hewitt, and we've been able to achieve cost savings while improving patient care outcomes and patient satisfaction. I'd like to share a brief summary of the critical elements that make up an accountable care organization. Evidence-based medicine, a high level of care coordination and integration among providers, a fully integrated electronic medical record system. It is accountable to the total cost of care, quality, and patient satisfaction of the plan, and is able to achieve cost avoidance by focusing on preventive care that identifies disease early, continuously intervenes on progression of a disease, as well as manages chronic disease conditions like diabetes and hypertension. By doing these things, accountable care organizations have demonstrated the ability to achieve a lower total cost for the companies and high-quality care for patients. I'd now like to introduce Dr. Tony Lynn, Kelsey-Seybold's Chief of Internal Medicine and Head of Kelsey-Seybold's Hospitalist Program. Dr. Lynn plays a key role in our ability to remain accountable to patient care and managing cost. As a hospitalist, he is one of several Kelsey-Seybold physicians responsible for coordinating patient care when they're hospitalized. He has many patient stories, but today he will share with you a patient experience from last year where a 32-year-old Kelsey Care member was diagnosed with diabetes. I'd now like to turn it over to Dr. Lynn.
Thank you, Kenneth. I'm pleased to be here today to share with you a patient I met in the emergency room at St. Luke's Hospital. Her name has been changed for this story to protect her privacy. But first, we'll have a short video to play for you to give you some background on how I came to meet Lily.
Meet Lily. Lily is 32 years old, and she became a member of Kelsey Care in 2012. As a Kelsey Care member, Lily has a team of professionals proactively looking out for her health. The Kelsey Care Accountable Care Health Benefits Plan means that her team of doctors, nurses, and medical professionals actively work together to coordinate her care. As a new Kelsey Care member, Lily was encouraged to meet her PCP for a preventive health visit. Not only did Lily and her new PCP, Dr. Ohia, get to know each other better, Lily's blood test results indicated high blood sugar, possibly early diabetes. Follow-up testing is needed to confirm. That is when Lily's healthcare team goes into action. Dr. Ohia's nurse called and emailed Lily via My Kelsey Online to remind Lily of the testing. But as Lily got busy with her life, the testing became secondary and got put on the back burner. As part of Kelsey Care's disease management team, Noemi Samaniego, RN, Lily's Kelsey Care clinical disease management nurse, began reaching out to Lily. Noemi is different from most nurse case managers in typical fee-for-service health plans. She works for Kelsey-Seybold and with Kelsey-Seybold doctors, not for an insurance company. She is embedded in Lily's clinical team and works directly with Lily's doctors. She also has complete access to Lily's medical records through Kelsey's electronic medical record system. Noemi does more than just check in with Lily to see how she's feeling. She monitors Lily's compliance with her treatment plan. She notices Lily has missed a scheduled blood test. Thanks to Noemi's persistent reminders, Lily decides to go ahead and get her test and see her doctor. She was feeling kind of tired anyway. She allowed Noemi to make her appointment for the Friday before Labor Day weekend after work with Dr. Ohia. Lily's blood sugar test shows dangerously high blood sugar levels. She may need to be admitted to the hospital. Lily is about to meet another team member who plays a critical role in her Kelsey Care plan, Dr. Tony Lynn, one of Kelsey-Seybold's hospitalist physicians, stationed at St. Luke's in the Texas Medical Center.
Okay, I'm going to pick up the story for a few minutes here and tell you about what we were able to do for Lily when she arrived in the emergency room, thanks to our tightly coordinated network of doctors. As a hospitalist, I'm of course based in the hospital with the responsibility of managing hospitalized patients. So I was able to run downstairs to meet Lily in the St. Luke's emergency room after being sent by her physician, primary care physician, Dr. Ohia. And I continued the treatment of hydration and medications that were started by the emergency room physician. Having a blood sugar level of 582 is very high, and that can lead to DKA, or we call it diabetic ketoacidosis, kidney failure due to dehydration, or coma, and sometimes death is also a possibility. So the initial impression and plan by her PCP and the ER physician was to possibly admit Lily to the hospital for a few days to control this blood sugar. But as I talked to Lily, reviewed her lab results, and examined her further, I found Lily to be healthy otherwise and a very quick learner. We love to partner with our patients to manage their medical conditions, and in this case, Lily was a great candidate to do just that. With the tools and resources I have at Kelsey-Seymour Clinic, we may just be able to pull this thing off and avoid a hospitalization completely while achieving a good outcome for Lily. After Lily received some insulin and IV fluids, she was stabilized and her blood sugar level dropped down to around the 200 range. And she felt well enough that we were able to discharge her from the emergency room and let her go home, again avoiding a costly hospital admission. I was confident in discharging Lily home instead of admitting her to the hospital because by the time she left the emergency room, she already had a follow-up appointment made with Dr. Ohia scheduled for the following Tuesday morning. And she could also reach me anytime that weekend through our Kelsey-Seybold contact center as I was on call anyway, and having in her hands detailed instructions for her family so that they could also help her continue to get better at home. After her discharge from the emergency room, I entered my treatment and test results from the emergency room into our electronic medical record, EPIC, at Kelsey-Seymour Clinic, so that I know by the time of a follow-up appointment in 3 days, Dr. Ohia would have the information to continue Lily's care. This story is significant for many reasons. One, we were able to hand carry Lily through the system and quickly get her stabilized in the emergency room using an outpatient process. Had she not come in for her blood work and appointment with Dr. Ohia, she would have likely ended up in an even more emergent and possibly catastrophic situation over the weekend. That would have probably involved an ambulance ride, probably even more time in a random emergency room somewhere with no prior medical information, and most likely a hospital admission, as well as possibly other complications as well. So not only did we avoid a catastrophic event, we were able to get Lily well and home to enjoy that holiday weekend with her family. To me, that is good patient care and good business, and that is what an accountable care organization is about. By the way, when I last checked on Lily's progress, her diabetes had been stabilized, and for those of you who know diabetes pretty well, her hemoglobin A1C initially was over 11 when she came to the Kelsey-Seymour Clinic, and 6 months later, it was 6.2. That is impressive. Now let's hear about the other great results Lily achieved and what we were able to do in regards to the total cost savings for the health plan.
Since her visit with Dr. Lin, Lily has worked hard to get her health in control and has achieved many positive outcomes. She's lost 22 pounds. Her diabetes is stabilized, and she has normal foot and eye exams. Her HA1C has decreased from 11 to 6.2 in 6 months. If Lily had been in a traditional fee-for-service insurance plan instead of with Kelsey Care, her journey and outcomes could have been different. She and her employer would not have benefited from the tightly coordinated care delivered by her Kelsey Care medical team. For Lily, Kelsey Care's Accountable Care Health Benefits Plan in action meant her diabetes was caught early and stabilized. Her Kelsey Diabetes Management Nurse, Noemi Samaniego, actively monitors Lily's status using her Kelsey-Seybold electronic medical record. Her employer avoided a catastrophic claim thanks to Lily's Kelsey Care dream team of doctors and nurses. Real-time coordination between Dr. Ohia and Dr. Lin meant Lily avoided a costly hospital admission. In addition, Lily avoided the emergency room on several occasions after this, thanks to Noemi and Kelsey-Seybold's after-hours telemedicine nurses. And most importantly, Lily got to spend more time with her family and even buy new clothes several sizes smaller. Lily's story is real, one that happens to Kelsey Care members each and every day. Lily gets the benefits of having a true health partner who works with her on maintaining and improving her health. This is not something Lily would have received in a traditional fee-for-service model. Kelsey Care, it's accountable care in action, delivered by Kelsey-Seymour Clinic, the nation's first accredited accountable care organization.
That was the story of Lily, a diabetes patient and a Kelsey Care member. As you heard, through our coordinated approach, we were able to make several positive impacts in her life. Thank you, Dr. Lin, for sharing this story. I'd like to open the floor to any questions you have for me or Dr. Lin.
the first question I have here is, does an ACO concentrate more on the quality instead of quantity? Definitely. I think an ACO, and certainly the way Kelsey has always operated, and particularly on a capitated basis, we do pay attention to not just the quality, but also if the testing are evidence-based. So in an ACO, I would say quantity will be monitored, and quality will be more emphasized. Here's another question, and this is probably a one that I'll just try to touch on. Once a patient has type 2 diabetes, is there a known treatment that will make it go away? Type 2 diabetes is something that once you have it, you will always have it, but it can be controlled to such a degree that you may not even need medications. In Lily's case, I wanted to share with you that the hemoglobin A1C 6.4 and above is considered a diabetic range diabetes, and that may need to take medication. So at some point, Lily's diabetes is so well controlled with weight loss and diet, the doctors may actually start tapering down or cutting down her medication dosage. So it won't go away, but it can be controlled well. Here's another question I'm going to try to see here. Gosh, Noemi's is a real benefit to controlling medical costs. Would anyone have a nurse case manager if they subscribe to Kelsey Care? Ken, you probably could mention that. I think Kelsey Care and case management is all part of the same package.
Right. So as part of the Kelsey Care plan, members are a member of the full Kelsey Care or the full Kelsey-Seybold Clinic, managed together along with their PCP with specialists and case managers or nurse managers when needed.
I got another question here. What does level 2 ACO accreditation mean? How do you get to number 1? I probably need to brush up on this, but I'll take a guess at this, having read quite a bit about it. Actually, level 1 may be lower. I think level 3, which is the highest level of ACO, require that you have been accredited for at least 1 year or possibly 2 years. So level 2 is the highest level of accreditation that you can achieve starting out the gate. And so Kelsey-Seybold has been accredited as a level 2 ACO, and that is the highest we can go. Once we've accumulated a year of experience under the current program, we will probably go for the next level up. Next question, how did Lily become a Kelsey-Seybold patient? Is it through her employer medical plan? Having looked at Lily's chart to review the medical case, I would tell you that she was new to Kelsey in 2012, and I believe it was through her employer because it's Kelsey Care patient, and she came to the clinic for a physical at the encouragement of her employer and as part of the plan to meet the PCP. And it was at that visit when she was asymptomatic or no symptoms that she was picked up to have slightly high blood sugar level, and that triggered the rest of the treatment and the story that you heard. So yes, she did become a Kelsey-Seybold patient through her employer's medical plan. Another clinical question. Does tobacco use increase the risk of developing type 2 diabetes? Not that I'm aware of. Tobacco use does not cause someone to have diabetes and doesn't increase the risk of diabetes. However, diabetes and tobacco both does increase the risk of developing cardiovascular diseases. So the 5 risk factors for developing, whether it be heart attack or circulation problems or atherosclerosis, including stroke, are tobacco use, type 2 diabetes, hypertension that's not well controlled, high cholesterol problems, and certainly family history. And family history is the only thing that we really have no control over. So I usually tell my patients that of the 5 things that can cause you to have cardiovascular problems, you can control 4 of them. And so by controlling diabetes, not smoking, watching the blood pressure, and managing the cholesterol level, that's how we can keep someone very healthy. Next question. How many hospitalists does Kelsey Care have? Are you just in the Texas Medical Center? Kelsey-Seybold Clinic has both adult and pediatric hospitalists. These are physicians that are only practicing in the hospital with very minimal amount of time in an office. We have 2 pediatric hospitalists and probably about, and I say probably because sometimes we adjust numbers to meet the demand. We have about 15 full-time hospitalists throughout the city of Houston, specifically 10 in the medical center, 2 up in the Woodlands, 2 in the Vintage area, Willowbrook area, and 1 in Sugar Land. The other hospitals around town, we also work with non-Kelsey hospitals, but they are affiliated with Kelsey, so that we can work with them and coordinate care as well. So along with Kelsey hospitalists and the affiliates, we're able to cover pretty much all hospitals in Houston. All right, I'm told I've got time for one last question. Looks like it's a clinical one again. I'm just going to go along in the order here. How is diabetes diagnosed? Diabetes, first of all, I just want to tell you that, first of all, we suspect it based on clinical symptoms. So if you're drinking a lot of water, going to the bathroom, urinating a lot, and losing weight, feeling tired, that leads us to suspect diabetes. But the American Endocrinology Society does have strict guidelines. So if your blood sugar is over 126 with the classic symptoms, you have diabetes. So blood sugar level is what's tested. Sometimes we'll use something called hemoglobin A1C, and that is a blood test that can be checked every 4 to 6 months or so, and it tells you how your sugar's been over the last 4 to 6 months. Normal hemoglobin A1C is 5.6 or less. For diabetics, we like the hemoglobin A1C to be 7, in the 7 range or less. So for Lily, 11 is very, very high. That means her blood sugar may have been in the 300 range on average. With that, I'm going to turn over the microphone back to Kenneth.
Thank you again for spending your lunchtime with us today, and I hope you can join us next month for Dr. Patel, our Chief of Oncology and Hematology, as he shares the story of Joe, a 50-year-old cancer patient. His webinar will take place on Thursday, July 18th at noon. Please look for messages and registration information in the coming weeks from your Kelsey Care and Kelsey-Seybold team. Thank you again.